All right. Next up, we have Stroke Pro. Stroke Pro. Do we have them? There we go.
Thank you. Thank you. Stroke Pro. Imagine a world where patients and their family caregivers, so specifically stroke survivors, receive education in a language and format that they can understand. Hi, I'm Dr. Cleopatra Kum. I'm an assistant professor at the University of Cincinnati College of Nursing. My area of research interest is in stroke family caregiver health, and I've published my work at the local level, the national level, regional level, and international level. So I'm really interested in stroke survivors and their family caregivers. I also have some expertise in home health care administration. What's our problem? So every 40 seconds, someone in the United States dies of a stroke. Of these strokes someone in the United States has a stroke. Of these stroke survivors, about 23% are likely to have another stroke. And most of the time, the care provided is either by unpaid family members or paid providers, most of whom are unlicensed. So I'm talking about our home health aides and PCAs and other people that do not have a license. We know that stroke care is very complex. People spend time in the hospital and we send them home with a caregiver who is not sure of what to do. What are we doing currently? Currently, family members are providing this care, and then we also have our unlicensed personnel providing this care, and sometimes they are not adequately trained for the level of care that we need for people who have a stroke. So because of these options, you have stroke survivors who are delayed in the hospital because there's no one to provide care if they're discharged at home. Sometimes you have them being sent unnecessarily to long-term care facilities because we do not have that training to provide that care at home. What are the consequences of doing nothing? If we do nothing, people could die. We could also increase our 30-day readmissions, and we know that that is not good news for hospitals. It would also increase cost to hospitals and home health care agencies, and we can also lose some talent when it comes to the healthcare support sector. What's the solution? Our solution is Stroke Pro. So Stroke Pro is an online platform that is going to educate these caregivers, both family caregivers and unlicensed personnel, to provide care that is specific to stroke survivors in the home. Our target audience is going to be rural hospitals that discharge these stroke survivors to the home, and we are also going to target home healthcare agencies that provide non-skilled stroke care at home. We are going to save a lot of money doing this because we are going to reduce 30-day readmission rates, which is good news for hospitals. And we are also going to keep stroke survivors out of acute care settings and rehabilitation centers. We are going to strengthen our home health workforce through appropriate and adequate training. This platform is going to be very easy to use, and it's going to be backed by science and research. So this is a unique solution. It can be used by anyone. The goal is to train people in less than a week to provide care that is specific to stroke survivors. This is it's going to be designed with the help of all the stakeholders. So home health care administrators, the caregivers themselves, the professional caregivers, and even the hospital administrators. So what are the benefits of using Stroke Pro? So if we use Stroke Pro, then we can train caregivers in less than a week. If every caregiver did at least one module a day, then they can be trained to provide safe, effective, quality care to stroke survivors in the home. What would these modules consist of? So the modules are going to consist of, first, what is a stroke? What are the, how can we prevent another stroke? What are the interprofessional care planning disciplines and how to communicate among providers? We're going to talk about how the caregivers can care for themselves, because as we know, you have to be healthy to provide care to someone else. We are also going to talk about instrumental care like exercise, which is important in stroke care, and we are going to address community resources. We know by the research that people are open to using technology platforms when it comes to providing care in the home. What is currently being done by our competition? So when someone has a stroke, they stay in the hospital for some time, and when they are being discharged, a good meaning busy nurse gives them instruction and hands them a paper to go home. We all know what happens with those papers. People don't have time to read them. In addition, for home health agencies, their unlicensed personnel are provided 2 weeks of training, which is generalized training in everything. With Stroke Pro, the goal is going to be to put this education in the palms of their hands as technology. They're going to have 24/7 access to this technology, and they can learn this in less than a week. They can also refer to this later if they have any questions, and the care is going to be specific to stroke care. So last 2 weeks, I was opportune to attend a policy hackathon at the University of Miami, and among other government officials that I met, I was chanced to meet the senator of District 22 of Ohio, and ran the idea by him about the need for chronic education training in Ohio. And he was very open to the idea that we do need that chronic education training, especially in the home health setting. So what is the ask today? The ask is for any connections and access to home healthcare administrators, because they are going to be very instrumental in developing this technology further. We are also looking for software experts in terms of putting this technology in electronic format, so we can put it in the palms of our caregivers 24/7. We are also needing prototype testing, and as we know, funding is always an ask. Thank you.
Thank you. That was great. You hold on to this. Does anybody have any questions for the professor?
So I had a quick question about like the interface, or if you've thought about that much, but do you guys plan to have kind of like I guess a contact us page where like people could get in touch with like healthcare providers to ask additional questions outside of the module? Have you thought about that much, just out of curiosity?
Yes, thanks for that question. So the thought on that is more of a nursing coaching model where we would, and this is down the road when the technology has been well developed and we have that tested and all of that, we are going to put nurses on the other end of the line so people can ask questions. Because you know, once someone leaves the hospital and they get home, they have a million questions, and usually there's no one to ask it to.
Other questions? Amanda?
In addition to the home health care networks, have you explored using this to train social workers who are part of community paramedicine programs?
I have not thought about that yet, but that would really be a good idea in terms of care navigation, so thank you.
I've got a contact for you.
Thanks,
Okay.
I appreciate that, thank you.
Any final questions for the professor? All right. Thank you so much. Appreciate it.